middle of Port Moresby, what was once an aquatic centre is now a COVID-19 field hospital. 730 has been given access to the new Australian-funded centre.
Next is your gloves.
About 30 patients are being treated for COVID, but the hospital can take up to 270 people if needed.
But that will require more nursing and medical staff.
Today, a woman who is 5 months pregnant is about to be transferred because her condition has worsened.
She's become quite sick.
Yeah, she's feeling pain and she coughed up blood twice today.
Okay.
So that's our concern from that one.
The centre is caring for mild and moderate patients to ease the burden on the city's main hospital.
And this has given us some resilience if we see a continual increase or even a worsening of the situation here in PNG.
In March and April, PNG's case numbers jumped 8-fold. There has been a recent fall, but authorities warn that could be in part because of delays getting test results. Only 93,000 tests have been conducted since the pandemic began. Nurse Nellie Jambi treats COVID patients at the Port Moresby General. She's worried about another big surge.
It's very busy. In a day we get a lot of more new admissions. Deaths every day.
She works with the most serious patients and has seen regular bed shortages.
It's difficult. We just have to create space to get them. We can't just send them away.
20 Australian medical workers are in the country to help bolster the under-resourced health system. They've helped set up this triage system outside the hospital to better protect staff inside and to allow them to focus on other issues. Most services had to be scaled down or halted when the COVID surge hit. Getting them functioning again is a focus.
TB is still there, malaria is still there, heart disease, kidney disease are still there, so we still got to provide that service as well. If we do not provide those services, we are creating another comorbidity for the virus to attack, so we've got to get back to providing those services.
The coronavirus has shone a light on the poor state of PNG's health system. At the start of the pandemic, it was estimated that there were only 5,000 hospital beds and 500 doctors for the country's 9 million people. While cases seem to have stabilised here for now, there are concerns there could be more spikes, particularly in rural areas where there are even fewer resources. And the Australian Emergency Medical Team is set to head home within days.
I think it's highly possible that there will be surges, but my personal opinion is that there will be surges in the provinces. There will be a surge in one province or another province. And the response will really be dependent on what New Guinea asks for and what the Australian government offers to decide what we do in the future.
More than 130,000 doses of the AstraZeneca vaccine have arrived in PNG and a national rollout started this week. Australia has committed to donating more doses to PNG, but there's far from enough to vaccinate the whole population.
Papua New Guinea is a perfect example of why vaccine equity is so important.
But getting vaccines into the country is just a start. People need to be convinced to take them. 70% of doctors from Port Moresby General have opted in and less than 10% of nurses. So far, Nellie hasn't taken it.
After I read, went online, watched from YouTube, all this, still I am not convinced to get the vaccine. So maybe later. I'll see first how the people who get vaccinated first, how they go, and then I'll decide from there.
With social distancing and face mask directives not being widely followed, PNG is placing a lot of hope in vaccines. Authorities are bracing for the weeks and months ahead.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.